I'm Dr. Ange from the Wellman Clinic in Peterborough, Ontario, and if you're interested in having a more comfortable pregnancy and an easier labor, then today's video is for you. Let me ask you a question, mums-to-be. To this point in your pregnancy, have you given any thought to the importance of the position of your pelvis, not only for a comfortable pregnancy, but for the position of your baby and the comfort of your labor? If your answer is no, then you're not alone. Not many women do consider this, but here are 3 reasons why it's really important. First of all, the pelvis is the passage. Quite literally, it is what your baby has to travel through in order to be born. When you look at the pelvis, it makes sense that if your baby's coming through there, you would want that to be pretty aligned, doesn't it? Secondly, pelvic misalignment can be a cause of a lot of discomfort and pain in your pregnancy. And thirdly, the tension in your pelvis can be creating what is known as intrauterine constraint. And essentially what that is when external forces are affecting the position of your developing fetus. So what causes pelvic misalignment? Essentially, there are 2 main things that are contributing. The first is hormones. So early on in your pregnancy, your hormones start to change, and it can cause your ligaments to become lax, which can lead to joint instability, especially in the pelvic area, and especially if you have a previous history of low back or pelvic pain or injury to your pelvis. The other contributing factor is the change in your center of gravity. So as your belly grows, it causes your center of gravity to come more forward, which is going to put increased stress and strain through your low back and pelvis. These changes can create pain and discomfort in your pelvis and can lead to a longer, more difficult labor. The good news is there are things you can do to help. Here are 5 simple things you can do to benefit your pelvis during your pregnancy. The first is to get your spine and pelvis checked by a chiropractor that specializes in pregnancy or prenatal chiropractic. The chiropractic adjustment can help offset the changes that are happening in your pelvis and can help prime that passage for a smooth delivery. The second thing is move your body. Exercise is so important. The third is to make sure your pelvic floor is strong. Do those Kegels. The fourth is to avoid prolonged standing and sitting. It's really hard on the pelvis. And the fifth is to wear flat shoes and make sure that they're good supportive shoes. This is a great time to pull out those Birkenstocks. Pelvic alignment is really important for a healthy natural labor. It is one of the best kept secrets. If you have a girlfriend who's pregnant and could benefit from this information, please tag them. Thanks and have a great day.